why do you say that beans are good for our brains?
Beans are good for our brains for a couple of reasons. If we're eating beans, we're not eating French fries, hopefully. So we are taking a food that's rich in fiber, rich in nutrients, naturally low in salt and fats, doesn't raise blood sugar much. In fact, beans are very good food for people trying to avoid or reverse diabetes. So it's what we're eating in place of some of the foods that might not be optimal for brain health by avoiding excess saturated fat in cheeses and meats and fried food and processed food. Um, I'm not aware of a particular nutrient in beans that you say that's the magic. We sometimes talk about blueberries having a brain supportive, a super rich antioxidant profile that helps um, brain health. A turmeric, a spice that's very anti-inflammatory and seems to be supporting good brain health. These are things we commonly talk about. Rosemary. You want to add a little brain-friendly spice to your soup you're making today. You want to put in a lot of rosemary. There's a famous little village in Italy I visited about 3 years ago, south of Naples, called Acciaroli, and they have excellent health to old age. And they are the rosemary capital of Italy. There's rosemary in everything. And Shakespeare said 500 years ago, rosemary helps your memory, and science actually supports it based on analyzing what's in there. So I would put rosemary on my beans. I don't think I'd put blueberry on my beans. I might put turmeric on my beans, but I would keep eating beans.
How do we know if the benefits of a medical treatment or test outweigh the risks, and who should we listen to?
Yeah, tough, tough, tough. And that's where second opinions for elective procedures is something I write about, something I strongly encourage. I'll give you an example. I was trained and have performed thousands and thousands of heart catheterizations. Poke the groin, the femoral artery, poke the wrist, the radial artery, thread a little tube up to the heart, inject dye into the heart arteries, and then get the little puncture to stop bleeding. Generally a safe study, but there is the real risk of bleeding and kidney damage and blood vessel damage. And there are people that have strokes or die from a simple outpatient heart catheterization. Well, that's no longer the only way to get accurate information on heart arteries if you feel it's needed. And I'm not talking in an emergency setting where somebody's in the midst of a heart attack, but I'm talking about outpatient scheduled. One of my patients was told 6 weeks ago, you need a heart catheterization, and was scheduled, 6 to 8 weeks later. Well, there's no emergency if you're having a heart catheterization scheduled in 8 weeks. There are CT scans if we absolutely need to know heart anatomy just through a simple IV, and there's nearly no risk to that. They can give the iodine through the IV. It'll reach the heart arteries. You get the same or actually more sophisticated analysis of the presence and degree of blockage. And you have to be concerned about whether you have an allergy to iodine, whether your kidneys will clear the iodine, but you've eliminated all that other significant risk. And I encourage my people, wait on the invasive procedure. There is no guaranteed safe procedure, from a colonoscopy to an endoscopy to invasive procedures for sure. They're generally safe and they're generally low risk, but it's fair to question, do I really need this? So a second opinion, if you can find somebody willing to, in my field, look at the stress test, look at the electrocardiogram, take a history, no data like the ischemia study that showed medication, low saturated fat diet, and exercise did as well as bypass surgery. Well, if you've got that in your back pocket, you got to ask the question, why am I having a heart catheterization, an invasive test? Why can't I adopt the pattern they used in that research study, or why can't I have the CT angiogram and avoid somebody threading a tube through my blood vessels and taking some risk? So it just takes education and courage to ask the question or say, I don't want that. And it can be overdone. I have patients that don't want procedures and they actually probably need them. A lot of people avoid colonoscopy, but now there's a stool test called Cologuard that is at least a reasonable substitute for many people. But, so I don't urge people to stay away from the medical community, but question procedures.
How do you prevent against osteoporosis and broken bones?
Yeah, bone health is important. Certainly, if we're looking for good health in our 70s, 80s, and 90s, we don't want vertebral fractures, rib fractures. We don't want to fall and have a hip fracture. These can all be both debilitating and actually lethal as we get older. So, regular fitness and exercise to maintain your muscle mass. A lot of weight bearing exercise. So, swimming is awesome, but you want to also walk. You want to also maybe use a rebounder or a treadmill so that your body weight is there. There is some data that wearing a weighted vest during exercise doesn't have to be excessive to hurt yourself. Puts a little more weight on your bones when you're exercising and builds stronger bones. You want to have adequate nutrition and the vitamin D, the vitamin K2, a spectrum of what are called micronutrients that generally come from food, like Brazil nuts to get that selenium as an example. And you can test for it. You can do, excuse me, bone density testing. It's an industry, bone density testing and injectable drugs and expensive drugs for bone health. Some of them have serious side effects. You're giving a drug for bone health and it degrades the quality of your jawbone health. You end up with sort of a oral emergency. You have to read and question and say, I think I'll try a lifestyle approach to my bone health. Add in some bone supportive nutrients.
How do you prevent arthritis?
Arthritis is an important topic because it is common and it certainly can degrade the quality of life of a lot of people. Some arthritis is, we classify it as degenerative. The common osteoarthritis, degenerative arthritis, although we know that that is also an inflammatory process. And there are data, does respond to whole food plant diets. It's not going to alter necessarily the bone structure, but the inflammation around the bone structure can be diminished. And then, other arthritis is related to autoimmune conditions, of course, rheumatoid arthritis and others that are less common. And a lot of that is gut health again. And we now have reasonable data that autoimmune conditions, which may be triggered by the environment, may be triggered by genetics, may be triggered by our food choices, do also respond, sometimes mildly, sometimes dramatically, to clean whole food plant-based diets. There's no research on that. We didn't have that 15 years ago for conditions like rheumatoid arthritis. So again, prevent is the highest goal, and then treat and try and reverse is the next level of care. And you want super clean, super hydrated diets for arthritis. You want a lot of omega-3 from plant-based sources. So a lot of chia, a lot of flax, maybe a little bit more than the average person. Really bathe somebody in anti-inflammatory and antioxidant-rich foods. A lot of run-of-the-mill arthritis is related to excess weight, the back pain, the hips, the knees. So a person struggling with other diets, if they can successfully drop and maintain their weight with a whole food plant diet, it's going to help their arthritis for sure.